Okay, welcome friends. Welcome to NMBF Coffee Chats. This is basically a discussion forum where we all meet and talk about different topics. And Golden Jewel Seniors Meet is a segment on Thursday at 12 o'clock for seniors. And we are so happy. We think each of our senior is a golden jewel. They are so precious. They have rich experience of life and so much wisdom that has come to them. So we are very happy to know you and to learn from you. Yeah. And this is a place to meet, interact, make new friends. So please be in touch with us. Yeah. Right. So with that, I want to welcome our speaker today, Dr. Prem. Dr. Prem Naganath is the chief consultant geriatric medicine, elder care specialist, physician at Jaslok Hospital, Mumbai. And I've personally taken my father to him, and it was really a wonderful experience to be treated by a geriatric doctor. And I think in my experience, I could say that geriatric doctors are so important for any senior citizen, any elderly person, because they specialize in treating seniors, give medical treatment. And there's a huge difference between any general doctor and a geriatric doctor. So I will urge you to connect with a good geriatric doctor in your neighborhood. But if you can, if you're in Bombay, do connect with Dr. Prem. Okay, so with that, I want to welcome Dr. Prem, who's here today to share some healthcare tips for the seniors, and we'll be speaking for a length of time after which we can have a Q&A interaction. Okay, welcome, Dr. Prem. Thank you so much for joining.
Good afternoon, everybody. It's and thank you, Abhijit, for having me here. It's always great to be among older adults who actually want to know more about how to take care of themselves, but at the same time give us so much of wisdom because they have taken care of themselves till this particular age, and of course, not only taken care of themselves, but of course of their families as well. So I'm just trying to give you a bird's eye view on what comprehensive care for older adults actually even means. So, first of all, aging is actually not lost youth, but it is a new stage of opportunity and strength. I mean, this is one of the very, I think, great quotes by Betty Friedan. And I feel if this is the motto, then you will always age well. The motto should not be to get younger, but the motto should be to actually age gracefully. And most of the time, we have obviously done all our responsibilities, whether it's financial, whether it is even taking care of children. And aging should be looked at as a very positive aspect, wherein you get more time for yourself. You want to do new things which you have not done and continue to learn. So why am I even talking about this? Because even the World Health Organization is always emphasizing the same. Now, what has happened, of course, is uh, 2020 to 2030 was the WHO decade of healthy aging. And as we know, the pandemic sort of ate into it almost around 2 to 3 years. But however, I think it actually helped us because the pandemic gave us a new perspective of meeting people, even actually sharing counsel or even sort of reaching out to older people. I mean, I think the biggest example of post pandemic is where we are now. We are talking online. Earlier, I think, I mean, to be very frank, I had not heard of Zoom. So I mean, and now we have all, I mean, I have seen over the 2.5 years, 3 years of the pandemic and post pandemic, a lot of older adults are actually better than me also in Zoom because, as I say, that when older adults learn something, they learn it well and they don't learn for the sake of it. So why are we talking about this? Because every older person is different. I think that is the most important part here. The most heterogeneous population, the most different population is actually older adults. Now, some have the level of functioning maybe of a 30-year-old. So, for example, if you see Usha Soman, that is Milind Soman, who's a model. Usha Soman is the mother who's almost 75 plus, and she beats Milind Soman in marathons. So she is so fit. But at the same time, one has to understand that some older adults require full-time assistance. So whether it's for doing basic tasks, also whether for bathing, whether for eating. But a lot of times what happens is we keep rotating maybe from one side to the other. So we might be independent, we get some infection, maybe something, then we get a bit dependent for some time, but we come back. A lot of times you are not able to come back. What is important for this? The most important thing is health. Now, health is crucial to how we experience old age. I think that is what is very important. The more healthier we are, the more we have a chance of actually having a better older age. So, what influences health as we get older? I think it's the individual and the environment. One has to understand that when we live, we do not live in our bubble. We interact with an environment. So it is not only us that matters, but it is also the interaction with the environment. So I will dwell on what matters as an individual. So now there are a lot of behaviors. Now, by behaviors, I mean throughout. I mean, these behaviors don't necessarily come once you're 60. They come when you're early 30s, maybe even 20s in your formative years. So things like whether you drink alcohol or not, whether you smoke, those are of course the vices. But if you don't do that, what is the amount of water you drink, what is the type of food you eat, what is the exercise you have been doing? Yes, a lot of people can change as you get older, but what you set when you are younger is what might actually even dictate what you do as you get older. However, I feel learning is something which older adults can do any day, anytime. So behaviors can be changed, and that is the beauty of behaviors, but they affect health. Then age related changes. Now, one has to understand that as you get older, you are not, if you're 60 years old, means your brain is 60 years old, your heart is 60 years old, your kidney is 60 years old. So one has to be very, very careful about the fact that when we deal with disease, we are not dealing only with disease, we are dealing with an old person who has disease. So even the body ages, and one has to be very, very, I mean, a lot of lot not lot, I think most of the older people do understand that yes, that body has aged. One has to understand that, and depending on that, adapt so that they can live better. Now, genetics matters a lot. I mean, we are living in an age where if you see, the number of amount of cancers are also increasing day by day. So there is a huge genetics to that. As you get older, there's a greater chance of getting cancer also. That is unfortunate. With longevity, of course, there is a chance of increase in cancer also. But apart from that, people who have family diseases, like maybe if you have a history of heart disease, if you have a history of diabetes, stroke, so you should be more careful and do more health checkups at least to make sure that you don't get those diseases. However, that doesn't mean just because you have it in the family, you will have. But there have been cases, for example, 4 or 5 siblings have it, and that is your father or mother's, and then you have it, or your brother has it. So you have to be very, very careful. Then disease, I think disease would be something which nobody would want to have. But if you have disease, then it becomes difficult, and it obviously help affects age. So the lesser the diseases you have, the more healthier you are. The more the diseases you have, the more chance that the health goes down. Then environment matters. Now, as I said, interaction is constantly happening. So what is important environment from an older person's perspective? Housing is very important. Why? So for example, a person has a very bad knee, lives in the first floor, but there is no lift. So you can imagine going up and down stairs is not that easy as you get older with bad knees. So that's why housing is important. So in this housing, if there was a lift, I would have been more happier, because a lot of times what happens when the knees go bad, they cannot get down. Person was outgoing, wanted to meet people, is not able to meet anymore. And that can lead to isolation, depression. So a small thing can actually become very big if things are not taken care of. Then assistive technologies. I think assistive technologies matter so much. The word itself has assistive, so it is for assisting you. Now, whether it's a hearing aid, or whether it's a walker, whether it's a stick, or whether it's even spectacles. I mean, most older people do not have any friction to wearing spectacles, but when it comes to hearing aid and maybe even a stick or a walker, they are not very happy. Now, one has to remember that you are not dependent on them; you are independent with them. So that is the thought process which you should have. So if you are not able to hear and you're using a hearing aid, it is making you more independent rather than you getting dependent on them. Then transport, yes, we are getting there. I will not say we have reached perfection, whereas all the transport facilities are as good for older people, maybe. as compared to maybe somewhere abroad. Just having seats which are blocked for older people is not the solution. It has to be used. Now, I'll give you an example. Even in bus stops, a lot of you might still be taking the bus or maybe even taking the train whenever you have to, whether it's intercity or during the city or even in the car. So, do you think that the bus stop and the height where you get into the bus is very ideal for old people? Not really, because the bus, because there is no real kind of, you can say, ascent in there. There is no higher ground where which is equal, because you always have to go to a higher ground as far as the bus is concerned, even to enter it. And of course, the crowd in the bus is an entire different story. So transport we are getting there, but not really there completely. Social facilities matter a lot now. So health is a state of physical, mental, and social well-being. So getting together in groups, whether it is having satsangs, whether it is actually going to the temple, going to the church, having a church group, whether it's actually going maybe into a book reading club, or whether it's going to just clubs to meet people. Ultimately, social facilities matter a lot. So the more facilities are there, the more you're able to tap into them. That's why we always encourage old people to be socially connected, because in the pandemic, I think a lot of older people understood that even if you're physically and mentally okay and you're socially disconnected, then it obviously helps the other two as well. Then why are the older people different? Now, there is something known as homeostasis. Just don't go into the medical jargon. I'll explain to you. The thing is that the way the body reacts to stressors. So, if you are maybe a 40-year-old, the reaction to your body will be maybe much more milder. But if you're a 60-year-old with disease, then if you get an external sort of problem, then it can get more worse. So, the way your body handles stressors. So, the way an older adult reacts to stressors is how fit they will be. Then multiple morbidity. By morbidity, I mean disease. A lot of times, an older person does not have any disease at all, but a lot of times they come 1 plus 1 plus 2 plus 3. So if you have a diabetes, you can end up getting maybe stroke, you can end up getting heart disease, you can have cholesterol. So they come together. So that becomes a bit of a problem. Then atypical disease presentation. So when you were children, when we are middle age, if you get a pneumonia or a chest infection, you'll always have cough, you'll have fever. But in an older person, it's not necessary. They can purely have just maybe some cough, maybe not cough, just have altered sensorium in which they are not understanding what's happening, where they are, and then that's about it. And then we discover, no, it's actually a chest infection. So the presentation is not as it is given typically, but it is quite atypical. Then drugs. I think everybody who is on this call might vouch for the fact that if they are on drugs, then that is always a positive and negative to them as well. Sometimes drugs can be too many, and every drugs have side effects. Now, these drugs also include Ayurvedic, homeopathic, and alternative medicine. A lot of times, what happens, older adults do not tell that, thinking, no, this is not that doctor. But that is not the case. In my case, I obviously ask all the drugs. What we need to understand is whether any drugs are having interaction, or again, another thing is whether you're taking any over the counter drugs also. Sometimes a lot of older people just go to the chemist, if they have a headache, they just take drugs. Of course, most drugs are now only given through prescription, but be very, very careful on taking over the counter drugs. Always try to ask your doctor before doing it. Then, attitude of the elderly. I think a lot of times, most elderly are uh, actually quite positive. But a lot of times, people who are in their 50s, late 50s, they're just going to turn 60s, they can just suddenly get into a fact that what am I going to do after 60? Oh my God, I'm 60 now. So that has to be thought out well. So I'm sure when you planned your 20 to 25 to 30 years or 40 years of work, you should also plan post work. See, retirement is just a something which has been put by the government. It doesn't mean you need to retire. You can take a break, you can continue to work, but pre prepared for retirement, what you're going to do. Just don't think, oh, I'll have a lot of time, I'll think what to do, and suddenly you realize you have too much time but you don't know what to do. So I think it's very important that you plan for it. Then attitude of relatives are always helpful, they always want to care, but a lot of times trying to help older people, they might take away things. What do I mean by that? For example, a homemaker who loves cooking, who's fit, but maybe just is visiting her children. So the children are like, no, no, we have cooks, you don't need to do all that, you rest, you have come here for resting. But maybe we are taking away a passion away, and then that can actually lead to a lot of issues, especially mentally, because and when a person loves to cook, they actually really love to cook, and it's something they're passionate about. And treatment challenges, it's not very straightforward. As I said, we are always dealing with an aging body along with disease. It's not only a disease, but it's an aging body also. Then social issues, a lot of social issues are there. Now, for example, when you're living, are you living alone? Are you living with somebody? Do you have your spouse? Are you a widow? Do you know your neighbors? At the time of emergency, are you going to be, who is going to help you out? Which is the nearest hospital? Are you friends with your with your neighbors? Who is the point of contact? Emergency contact. A lot of things matter. And of course, elder abuse is another thing which has been seen quite extensively. So, of course, that is an entirely different topic altogether, but that is also one of the important social issues. And I think geriatric syndromes, which I will come to. Before that, I just want to get into the word definition itself. So, what is geriatrics? Geriatrics is actually derived from geras, which is old age, and itrikos, which means healer. So, Ignace Leon Asher was a physician. So, he said if pediatrics can be treated separately, then why not geriatrics? Because older people also need specialized care. So, this is, of course, which came up in 1909. And of course, this branch is basically dealt with a diagnosis, treatment, and prevention of disease. The reason I'm saying prevention, because a lot of time when we feel that as you get older, no prevention can be done. Of course, things can be prevented. You can modify your lifestyle. Vaccinations, which were something which you did not even want to maybe even think about before the pandemic, but COVID has at least changed that, where you have actually sort of become more cognizant of the fact that you want to even take vaccinations because that was not something you wanted to do earlier. And a lot of old people are asking for vaccination. So prevention through vaccination is very much there. Then there is also age groups as you get old. There is something known as young old, which is between 60 to 69 years, middle old, which is 70 to 79 years, and old, which is more than 80 years. And now, of course, we feel that we are pushing the envelope wherein old might even become more than 100 because a lot of people are actually living longer due to better health care facilities. And of course, the fact that they must have done something right. So, for example, in the pandemic is when we discovered there was a 100-year-old who actually has seen two pandemics. So has seen the Spanish flu as well and seen this pandemic also. It's unfortunate that she had to see that, but what I'm trying to highlight is the longevity. So we are looking at living longer. Now, who is a geriatrician? A geriatrician is a doctor who is specifically trained to evaluate and, of course, even manage the unique healthcare needs or and treatment preferences of the older people. Now, why do I say treatment preferences? Now, in older person, 1 plus 1 can be 2 and 1 plus 1 can be 11 also. So let me explain. So, for example, if an older person has bad knees and does not want to do surgery, maybe even the painkillers are okay, but they're working mildly, but not necessarily completely. And if they ask me, yes, can I put some Ayurvedic oil? It gives me a good amount of this. So that is also okay. So what I'm trying to highlight here is what is okay in other types of medicine is also fine with me, but it has to be properly discussed. And number two, treatment goals of treatment are very important as with older people that what is their goal, whether it's quality of life, whether it's completely treating the disease, or whether it's to be pain free. A lot of times people are very clear on what they actually want. So, what are geriatric syndromes? So, just going to briefly tell you about this is quite rampant in old people. So, delirium is something where an older person will just get in a confusional state. It can happen to a lot of people and lot of causes. For example, if the sodium falls, then if they have urinary infections, so even in case of chest infection, so plenty of causes. Then dementia. Dementia is the dreaded D that a lot of old people are worried about. So, of course, dementia is also has reversible causes. It's not that all dementia is irreversible. So, Alzheimer's is one of the most common, which a lot of you people will even recognize. Then depression. Depression is also quite common in old people, but it's a myth that all old people are depressed. That's why it has needs to be highlighted and needs to be checked about because if a person with depression is not treated, it can really become bad. If a person with depression is treated at a good time, then it can be cured. So depression is curable, so there shouldn't be a taboo as far as talking about your mental health is concerned. And of course, this was happening through all age groups, wherein after the pandemic, at least more and more people are coming forward and even talking about. Then falls. I think falls does not have a treatment. It is only should be prevented because treatment could be anything. A person could have hip fracture. A person could have mental issues in which mentally down after fall, losing independence. So falls has to be prevented. It is one of the most catastrophic events in an older person because what happens is even after falling, a fear of fall sets in, loss of confidence sets in. So these are things which can be really worked with. So prevention of fall is more important than treating the cause only. Then urinary incontinence. I think one of the most common syndromes which a lot of old people do not tell themselves is about urine. A lot of females and males both have lost control on urine as they get older. There are causes sometimes. For example, prostate can be there in males. In females, of course, depending upon the number of abdominal surgeries. Uh, for example, if you have two, three children, all of them have been cesarean, so the abdominal wall becomes weaker. And again, even postmenopausal, overall, because of hormones not being there, there is a greater chance of urinary incontinence. So I think that is something older people might not necessarily say until unless we ask. So we always try to ask whether there is any problem in urination. Then pressure sore is something nobody really wants, which means that you are actually on bed. It is something known as bed sore, and it is something which can be really, really bad. Why? Because if the person will be bedridden, and it will be difficult to treat. Then, of course, frailty. Now, frailty is basically a geriatric syndrome in which a person who is frail will technically not recover at a good time as compared to a person who's not frail. So, for example, if we talk about a graph for frailty, a person who is not frail might get a urinary infection, might recover, but come back to their original health. But a person who is frail might get the urinary infection, might improve, but would not get back to their original health. So that is what frailty is. A person who's already frail, we have to be very wary about how we treat the person. Then malnutrition. People always thought that malnutrition is only there in the young. Absolutely, that's not the case. Malnutrition is also there as you get older, and a lot of things matter. Things like loss of appetite could be there. Diseases can cause malnutrition. But two, three things which matter a lot is one, of course, a lot of old people can lose a loss of sense of smell, and then vision, and thirdly, teeth. So these three things are very important for food, actually. You always get stimulated by actually smelling the food, visually, how the food looks always tempts you. And then, of course, if you're not able to chew anything, then obviously it sort of leads to a decrease in appetite and ultimately worsening nutrition. So malnutrition also matters a lot, and malnutrition has to be intervened at an earlier time. So improvement will automatically happen. Now, why are we worried? All these syndromes which I talked about can lead to a quality of life being worsened and ultimately can increase dependence, disability, and trigger what is known as a cascade of dependency. Nobody wants to be dependent at any age. So that's why I felt that I always say that even old people don't want to be dependent. Why do they want to be dependent? But that's why we are worried. If anything of these sets in and you get worse, then you might get dependent, and to get you to get you independent again becomes a challenge. Okay. Now, as far as geriatric assessment is concerned, this is what we usually do in old people. So I'm just trying to highlight that health status of an older person is not only depend upon on your medical conditions. It is usually dependent upon functional status, that is how independent you are. Then your cognition, whether do you have any forgetfulness, what's your brain health, your affective status, by that I mean presence absence of depression, how are you mentally, your social support, it matters a lot, your economic status, whether you are paying for yourself, whether you have insurance, whether you are dependent on your children or anybody else, or whether, so that we actually know whether we need to help you. And environment, by environment I mean both internal and external. By external environment I mean is as simple as even the height of your toilet. That matters, because if that is not okay, then the chance of fall can increase. And spirituality, religion and spirituality are two different things. One can be spiritual in any type of way. You can be meditative, whether you when you even listen to songs. But spirituality also matters a lot. Why? Because a lot of old people tend to really get mentally calm by being spiritual. And these are usually the domains which I usually see when I'm actually assessing an older person. So why to do this? Now, a lot of times an older person who is kind have multiple problems which interact, and I look at these interactions, that is the whole patient and not necessarily an organ, and identify current and potential problems. This is also the reason why only diseased older adults should not be doing this. Even normal older adults should be doing this. Why? Because they can identify not only their current problems but potential problems. So it's a continuum of care wherein we can judge whether you'll have problems in future. So I'll just tell you about one of the cases which I had seen. So it's an 85-year-old who had uncontrolled blood pressure. She was on blood pressure medication, so seen somebody else. So just a second blood pressure medication was added. So 2 weeks later, what happened is she had a fall. So then we obviously called her in and sort of got her relative also. We realized that she was living alone. She had a gait abnormality. She was had osteoporosis. She had memory impairment. She had urinary incontinence. She also had vision impairment, and she was having over-the-counter medicines also. And she had difficulty in cleaning. So we got the doctor, and daughter was not living in the same building but near. So we thought that she will have to help out. So she helped with the medicines. Then we got home therapy for the gait and balance, and osteoporosis also treated. And she was evaluated for dementia, but she had mild memory impairment. So that was only kept in mind. Her urinary incontinence was treated, and vision impairment was fixed with glasses. And of course, an ophthalmology person was introduced. Then over the counter drugs, whatever useless medicines were there, we removed it, and difficulty in cleaning was seen. A home evaluation was done, and fall risk, what can be that potential fall risk, was seen. So she came after the second visit, and on second visit she was fine. She did not have any issues with gait and balance also, and she was no longer going to the bath. So we also discussed about dementia and how she can live independently, whether she needs any help. Now, what I'm trying to highlight here is she was having increased rushing to the bathroom. So she was having issues. So what happened is ultimately she fell in her own urine. So that's what happened. And if this would have been evaluated earlier, maybe we could have helped her in the earlier case. So, what are the principles that a geriatrician looks at? One is we want to promote wellness and independence. I think that's the most important thing. And ultimately, what is important is either maintaining or improving the quality of life. I think that's what matters, quality of life and how independent you are. What is your quality rather than quantity? You might be alive for 10 years. If you're dependent, I'm sure you don't want that. Whereas if you're alive for 5 years and you're independent, that's what you would want. Let me say something about successful aging, because we are already going to talk about how to age well. Now, there are these three principles which should be followed. One is, of course, low risk of disease and disease related disability. So, avoiding disease. Sometimes you're not always able to do it. Then, maintaining a high brain function and physical function. And third thing which you can always do is engagement with life. I think that is one of the very important things, being engaged, being socially engaged. So, these are the three pillars. Now, another way, if you see graphically to show how you can have successful aging, is if you're able to manage your home and where you live, that's good. Manage your life and sense of life, basically being independent, trying to do things, doing your hobbies, and optimize your health. So, health is also important. By optimization, I mean do your exercise if needed. I mean, visit your doctor, visit your geriatrician, go do your yearly health checkups. Depending upon your disease, the frequency of health checkups could reduce, and maintain your home. Lastly, it's very important that you enable your support system also. By that, I mean there should be channels. So we should know who's your emergency contact, who's going to take decisions if you're unwell, which is the hospital, which are your emergency numbers. So get your ecosystem in place so that you can actually have a support system. Then three pillars of successful aging is we always keep, I won't say as we get older also, when we're young also, we always keep focusing on what we cannot do rather than focusing on what we can do. So as you get older, you should always look at selection. So what a person can still do. So a glass, when it's half full, can be half full or half empty. So if you see it as half full, then obviously you're more positive. So improve or strengthening such a function, what you can still do, and then you can compensate to use strategies to actually overcome your weakness. So that's how you age successfully. Now, I'll give you an example. There was an Austrian pianist. His name was Albert Schweitzer. So he was a very good pianist. He used to have a lot of uh, even concerts, but he got Parkinson's disease. So I hope you're familiar with Parkinson's disease, in which you might have tremors, you might have difficulty in walking. There is a lot of rigidity, and the chance of fall increases. But and people were like, okay, so he was a great pianist, but there it ends. So nothing more might happen now. So no more concerts. But he announced a concert. So people were like very, very enthusiastic and actually excited. We were like, okay, what is going to happen now? Because he's got Parkinson's. So He was a epitome of successful aging. And how did he do that? He had a brilliant concert because he only played those tunes which needed shaking. So he actually played those tunes which would be used through his tremors. So what I'm trying to highlight is we have to understand that as an old person, you have always adapted in life. And the more you adapt, you obviously have successful aging. So of course, any older adult will benefit with most things that I do and most things that geriatricians do. But a lot of old adults can have specific problems like multiple medical problems, multiple medications, then not able to do their activities, fear of fall, history of fall, sleep problems, memory problems, dizziness, recurrent urinary problems, constipation, weight loss, loss of appetite, feeling low mood, anxiety, constant pain, cancer, and even palliation. Whenever you visit your geriatrician, you should always have this. Why I'm saying is because it helps us a lot. Have your past medical history, have your current medications list. If you can bring your medications, that would be great. Then have your hearing aid. Why? Because when you come for a consultation, if you're not able to hear, then you are actually not able to convey everything. Then dentures, why? Because we need to see whether you're comfortable with them. A lot of times people say, I'm not going to eat in the hospital. But it's always better for us to know whether you're comfortable. The names of the doctors who have been treating you. Why? So that we can contact them, get in touch with them if needed. And notes on your family history because it will help us to know what you had, what your family had, and how you can help you. So I think it's very important thing. There is no such thing as age appropriate when it comes to play. At every age, play is not a luxury; it's a necessity. So keep doing things which keep you happy. And I think the wheels of life is something I am sort of not undergone it entirety, but a lot of you are undergoing it. But this is a fact. So when we are a child, when we are obviously a child, we might need help. Then we go into the maybe a tricycle, then we go to the bicycle, then we have a car, then we have a family, we have a car, then we obviously maybe post retirement get a smaller car, then we can even get a trawler. A lot of people do that when you get older, want to visit around. Then, of course, everybody is happy till here, to be very frank. And then even through the scooter, not everybody wants to be in wheelchair, but I mean, come on, technology has become so well that even wheelchairs are so good now. So people who are disabled also aren't really disabled because they're able to do everything. Wheelchairs even have tabs now wherein people can do everything. So I think the key is to make sure that your health is optimized and adapt to whatever level you are in your life. And that's how you can actually age well. So thank you. Come grow old with me. The best is yet to come. This is a famous sort of quote from Williamsworth word. So all I can say is I can help you in your journey to age well. I know death is inevitable, but how we go always is something which matters to most. So thank you. Thanks for your patient hearing. Thank you.
Thank you, Doctor. Such a brilliant presentation that was truly priceless. Yeah, now, friends, we will all move into the next segment and we will stop the recording here for this becomes one block.